those types of jobs, nursing, midwifery, like they're vocations. Do you know what I mean?
Got to be.
So if you're not interested in helping people or working with communities or certain communities, then don't take up them type of jobs. This isn't fucking Walmart. Do you know, this isn't your local Aldi or whatever, like where you could just be dashing around cans, because that's what I mean. People don't see the after effects of births like that. Do you know what I mean? Like, if by the grace of God you do make it through, thankfully this lady was okay and her son was okay.
Yeah, but they're saying that they're not even sure if he hasn't got ramifications for the years coming.
Yeah,
because he was born with his eyes open, and I thought that was very whatsy, because I've had both my children were born with their eyes open, and you know what I mean, like, and it says that he could have actually experienced post-traumatic in the womb.
I don't know.
Do you know what I mean? Because his mum is in dire straits.
Well, they know that they can feel the thingy, like that's why they say don't stress through your pregnancy and that, because they know that the babies can like feed off the emotions of the mom. When we was looking at the American stats, US stats, black women experience high maternal mortality rates, 2.5 times higher than white women, which is the equivalent of 49.5 deaths per 100,000 live births, compared to 19 for white women. But what I thought was crazy is that when you got to our stats, our ones is 3 in the UK. Yeah, we're 3.5 times more likely to have a higher mortality rate or to die basically during childbirth or in the first year after pregnancy than white women. So I was saying to you, and it like I wonder if ours is higher because we actually haven't even got the option normally. I'll
go to another hospital.
Yeah, of doing private healthcare, isn't it? Like we obviously usually would have our children on the NHS or through the NHS. So is it that our mortality rate is even higher because
we've got no choice?
We don't have choice. Yeah, like it all depends on where you live, which would have been more interesting as well, actually, to see like what areas probably had higher thingies than other. Because I bet like in the more affluent areas, their mortality rates are probably a lot lower than you know, the more poverty-stricken areas. Yeah,
but then again, actually, that's sometimes not the case. In the case of like the hospital, if a hospital has racist or you know, it could be anywhere. Could be anywhere in what's it? If
and I think if they're racist, then it doesn't matter, does it? Yeah, and that's what I was thinking.